This is Kim. I'm Dr. Wolk-Weiss, and Kim's been coming to me for how long?
6 years.
6 years?
6 years.
Yeah, a long time. Brings her whole entire family here. But today she's got a headache. So we're going to talk about your headache a little bit today.
Yep.
When to start?
This morning.
Yeah. Where is it?
Right here. Like.
How bad on a scale of 1 to 10?
It's probably about 6.
Yeah? Okay. So first thing we do when someone has a headache, and lots of people get headaches, is we're going to take a look at their neck, because that's usually where Kim's headaches come. Sometimes she gets them from her TMJ joint. That's another place that she gets headaches. So we're going to take a look at the top. A little tender up here?
On the right.
On the right side here?
Mm-hmm.
Yeah, your neck is definitely out of alignment. Another place that causes headaches is a lot of times in the upper trap here. Is it tender?
Not as bad as the neck.
How bad on the side? All right, good. It's more up in here. So let me get you lying on your stomach.
Stomach.
Yep. Kim's entire family comes here. Her kids, her husband. Every once in a while he shows up. But they really respond well to chiropractic care. So first thing we do is checking her leg length, because if the pelvis is out of alignment, that actually can work on aggravating all the way up into the shoulder area. So we wanted to check that. And we're going to work on her shoulders. I'm going to do a little pressure point work here to just try to relax the muscles. Is that too much? How's your shoulder doing?
I feel better. Oh, well, I mean, I have something to get tested on.
All right.
Something.
How's that there feel?
That's tender.
Yeah. So Kim's got a pretty good trigger point here in her shoulder, and what we're trying to do by putting some pressure on it is to relax it and stretch out some of the muscle fibers. And when you have a trigger point in here, and a trigger point's a knot in the muscle, and it can radiate all the way up into the base of the skull and definitely trigger headaches. Headaches can come from vertebrae out of alignment. Headaches can come from poor posture. Headaches can come from screaming kids. Can come from a lot of things. Sometimes even intestinal problems will cause headaches too. So take a deep breath in. All the way out. Good. Let me get you turned on your back for me. Alrighty. Yeah, your neck is definitely out of alignment. Tender in there?
A little bit. It's deeper than I can feel something going on, but
Right in there?
yeah, I think it's a little further down. But yeah.
Right there?
Actually, I think when you were
Okay.
yeah.
Right up in there? So what I'm looking for here is to find the trigger points or the knots that are in the base of her skull, right to her cervical vertebrae, the first cervical vertebrae. There's muscles that attach to it, and a lot of times when they get tight, besides pulling the vertebrae out of alignment, irritating the nerves, which trigger the headaches, it also the trigger points just irritate everything. Right there. Yeah, just that. And with muscles, you don't want to apply too much pressure, because you don't want to force them to start to tighten up again. You want to relax them. You want to get them, kind of coaxing them into relaxing. Is that okay?
I'm just trying to relax my arms, but
Put them on your belly. Go real easy.
you know I'm not relaxed.
I know. Good.
Felt something.
Yeah, we got a little bit of movement there. I'm going to come back and do this again. Alright, you sit up.
It hurts right here.
There. we got a little bit better movement up in her neck. We're gonna do a little bit more work on her shoulders too, to loosen them up. But that's the kind of thing we do here to try to get rid of headaches. So, we'll quiet down a little while. All right, good.